Thank you very much, Carol. Be up with you a little bit later. Thank you.
I will do everything I can to make sure I deliver for the people of this great country. That is the message from the new Health Secretary, Sajid Javid, as he begins his first week in the job.
The former Chancellor said it was his priority to bring about a return to normal as soon as possible following the pandemic. We're
joined now by Saffron Caudry, the Deputy Chief Executive of NHS Providers, and also by Pat Cullen, Acting General Secretary and Chief Executive of the Royal College of Nursing. Good morning to both of you. Thank you very much for being with us live on the programme this morning. Pat, can we come to you first of all? It is such an important job, isn't it? What do you think will be top of the agenda for Sajid Javid at the moment?
I don't think there's any more important job in government than looking after the health service and looking after the people. His most important priorities for nursing at this point in time is to put a national recovery plan in place for nursing that addresses the nursing workforce issues, the tens of thousands of vacancies that we've got right across England, which really can't continue. And we did see that through the pandemic, where nurses felt that they were very much approaching the pandemic with one hand tied behind their back, but didn't they do a fantastic job looking after the people? But those vacancies need to be addressed. We also understand that the pay review body, the body that recommends the pay award for healthcare staff, including nurses, may very well be in his in-tray this morning. And what we're saying to him, please don't insult nurses by awarding them a 1% pay award. That just will do nothing to try and hold on to those fantastic nurses that we've got in our system. Not one of them can we afford to lose, but it also won't attract nurses into the system. So that's a major challenge for the Health Secretary as he sits at his desk this morning.
Let's also pick up that thought with you as well, Saffron. So what do you think? There are so many things, aren't there, to be concerned about. What would you think would the main priorities be from your point of view?
Well, absolutely agree with Pat that workforce is a huge challenge. If you take that in the broader context, we know that there are probably three key issues that the new Secretary of State is going to have to deal with. We do have this new surge of COVID, so tackling that is going to be absolutely critical, and all focus is on that, alongside thinking about how we tackle the huge backlog of care that has arisen. So we know that waiting lists are at their highest ever level, over 5.1 million, and those who've waited for more than a year is also at an incredibly high level. So there's those two things, but also what we've seen recently is a huge spike in demand for both emergency care and mental health care. So alongside the broader issues like supporting the workforce, there are also these immediate operational challenges to which, of course, the workforce is central. But I think the huge task for the new Secretary of State will be to understand and learn about the NHS and really engage with frontline trusts, frontline staff to really see what the job is like.
Of course, there's so many different things here, Saffron. Just not least, of course, we're still, the NHS is being affected, isn't it, by coronavirus, by COVID?
Absolutely. So I think that whilst we know that we are starting to see the kind of chain between infections and hospital cases being broken by the vaccine, and that's a huge success story, and we need to build on that. We can't be complacent about that. And we have to remember that when we're trying to tackle this backlog of care, and when we're trying to think about how we manage that spike in demand for emergency care and all of the other things that the NHS does, like services in the community, that we can't be complacent about the fact that we aren't seeing this bigger translation into hospital cases that we saw before. Because we are also facing, we're pretty sure, a really tough winter ahead. So we need to be able to clear the decks for that and focus on that, because we didn't have a big flu cases last year because of all of the social distancing and infection control measures and the fact that we were basically locked down. So it's very likely that any kind of resistance to strains of flu is going to be much lowered. So we're seeing quite a perfect storm coming up in terms of the summer and then over into the winter. And we need to be able to prepare for that.
Pat, we were speaking to Matt Hancock, the old Health Secretary, on the programme when we were live at Coventry Hospital last week. And we put to him on that day the point that one of the senior consultants made there, that in terms of waiting lists and sort of catching up, he didn't think that the health service will get back to near normal in 5 and even possibly 10 years. Do you share those concerns over waiting lists and where we are at the minute, and concerns about where we will be in 5-10 years' time?
We do. We share all of those concerns because all of the pressures and the crisis that we find ourselves in at the minute, with our waiting lists, the backlog of people waiting for their first outpatient appointment, the crisis we've got in social care, the crisis we've got within mental health services, within primary care, all of those areas will not be addressed if we don't address the nursing workforce crisis. There's not a part of our health service that we enter at any time, should it be in the community, should it be in social care, should it be in mental health, that we don't need to come in contact with a nurse. And if you don't have nurses, you don't have healthcare. It's as simple as that. So the vacancies are central to all of the issues that the Health Secretary needs to address. And he needs to address it pretty quickly, because those waiting lists are totally out of control. The people that's sitting on those waiting lists are desperately in need of care, and nurses are in desperately wishing to address those waiting lists. They want to be able to provide safe, good, effective care for their patients. And it must be very difficult for each nurse entering their place of work this morning and this evening to know that they don't have the resources that they require to provide the best care possible. They're still doing that, and what an accolade that is to the nursing profession and to other healthcare staff, but they need the resources to do that, and the vacancies are important to address at this moment in time.
Thank you both very much indeed for talking to us. Pat Cullen, Acting General Secretary and Chief Executive of the RCN, also Saffron Caudry, Deputy Chief Executive of NHS Providers. Thank you so much.
Talking there about, obviously, the resignation of Matt Hancock.